We are in the office with Dr. Donald R. Nunn with the Beauty of Knowledge here in Atlanta, Georgia. Dr. Nunn, I thought we would do some questions today on facelifts. We have a lot of patients who come in and want to know several questions about facelifts, and if we could get those answered for some people before they go into a consult, that would be great.
To do it.
What is a facelift?
A facelift is basically a rejuvenation of the facial tissues to give more of a youthful look and refreshed look. It usually involves tightening the skin and the underlying areas. It specifically focuses on the neck, the mandibular jowls, and the cheek regions. But also upper facelift gets the brow, and a lot of times these procedures combined with other rejuvenation procedures such as blepharoplasty.
Okay. What facelift procedure do you use?
Generally, I like the new MAC. It's minimal access cranial suspension facelift, where you don't have to undermine as much skin. It tends to be a quicker recovery, less complications, less chance of bleeding. And then we use some resorbable barbed sutures, which help lift the underlying muscle fascia layer and the muscles in the neck. And I find this procedure to be very useful with a fairly quick recovery for most patients.
Okay. When I have a facelift, are all my wrinkles going to be gone?
No, there's no procedure to get rid of every wrinkle. Sometimes you have to do other ancillary procedures, either with or secondary. A lot of times when I do a facelift, I inject fat in some of the deepest wrinkles on the face, in the nasolabial folds and around the mouth, as well as in the lips and in the cheek region. But sometimes patients either need some resurfacing with dermabrasion, which can be done around the mouth at the time of surgery, or secondary chemical peels or laser treatments.
Okay. What is my recovery time for a facelift?
Most patients, I tell most patients they're going to look fairly good within 3 to 4 weeks. A facelift looks good at a month, it looks even better at 6 months, and continues to improve up to a year. And most patients feel fairly comfortable about going out in public and seeing their friends within 3 to 4 weeks.
Okay. How long after surgery do I have to wait to exercise?
I generally tell patients they can start walking immediately after surgery, but strenuous exercise I would give probably 2 to 3, well, probably more like 3 to 4 weeks.
Okay.
Depends on the patient's surgery and the extent of the surgery.
Okay. Is that the same for being in the sun, or?
Well, no, I tell patients that they need to be out of the sun or use sun protection for several months after a facelift, because that can affect the color of the scars and wound healing. So they need to cover with makeup that has sunscreen or sunscreen itself, or use a hat that covers up their face during direct sun exposure.
Okay. So how long before I go back to work?
Most patients feel pretty good about things at, again, 3 to 4 weeks. Most patients feel like that they can go back. Now, I've had patients go back within 1 week, but they're not healed. It all depends on what type of work it is. If they're working at home, they can go back to work the next week, but if they're working in public, sometimes they feel a little self-conscious because they're still swollen and bruised. Some recover as quick as 2 weeks, but I tell patients that when I see them that, you know, the average is 3 to 4 weeks before most patients would feel very comfortable with their look.
Okay. How long until I can wash my face, use face lotion, and put on makeup?
I tell patients they can wash their face the day after surgery and use lotions, but I don't want anything directly on the wounds for at least 2 to 3 weeks when the wounds are completely healed. So no makeup on the wounds itself. They can put makeup to help camouflage the areas where there's no incisions within the following week.
Okay. What are the risks and complications involved?
The main risk with facelifts are bleeding. I mean, you don't have large vessels, but you can have small bleeding under the skin. So there we have to be careful. Patients who have high blood pressure and things like that, we want it well controlled. We don't want them on any aspirin or any herbal supplements that can cause bleeding. The other thing is facial nerve injury. That is very rare. It's less than probably 1% if you look at all comers for facelift. And if it does occur, usually it's a temporary thing that involves like some weakness of their lower lip and maybe possibly around the eyes.
Why do I need to stay overnight after my surgery if I have someone to take care of me at home?
Well, I tell patients the reason I like to keep them overnight is the control of their blood pressure and discomfort, because usually if you're going to have any bleeding after facelift, you have it within the first 12 to 24 hours. But I think the first 12 is the critical, and an overnight stay with the nurse and keep the patient comfortable and is probably the best way to prevent a hematoma.
How long should I expect the bruising?
Again, the bruising usually is gone within 2 to 3 weeks, the majority of it.
Okay. When will you remove the stitches, and do you use any stitches that dissolve on their own?
Yes, there are skin stitches that need to be removed. I usually like to take those out at 7 to 8 days. The remaining sutures are resorbable. They're deep sutures, and they last up to 6 months. And that reason we put those long-lasting sutures, the tissues have healed in their new position, and you're less likely to have relapse by those. But those do not have to be removed.
Okay. How long can I expect my results to last?
Well, it depends on your genetics, your skin type, your sun exposure, and a lot of other factors. But the average longevity for facelift is probably 10 years. I tell patients that's a good rule of thumb. Again, some people only need one facelift in their life, and other patients may require a couple. But it, again, just depends on the patient's genetics and other factors. But usually if you do a secondary facelift, you don't have to be as aggressive as the first one, because that skin does not stretch out as much as it did the first time. And sometimes it can be a less involved procedure to just tweak the original facelift.
Okay, great. Well, thank you very much for answering my questions. You can go to www.drnunn.com and find out more about Dr. Nunn and his procedures. And you can also schedule a consult as well at 404-255-2975.
Thank you.